Hi, I'm Dr. Amy Alderman at North Atlanta Plastic Surgery. Just want to talk to you about how we're going to manage your pain after surgery. All patients are concerned about this, and we are too. We want you to have the best experience possible. We also have a huge opioid crisis here in the U.S., so we're going to have a special pain management for you to make sure you have the best experience and also do the best thing in regards to this opioid crisis that we have here in America. So number one, you're going to start taking Tylenol before surgery. You're going to take 650 milligrams 3 times a day, and you're going to start that 2 days before surgery. We'll have this all written out for you, but again, we'll have it prescribed for you. But taking the Tylenol before surgery will make sure that the levels are in your system to the adequate amount to optimize your pain relief after surgery. You will continue on the Tylenol after surgery for 7 days. Secondly, you're going to start taking Neurontin, and you'll take a dose of that before surgery. I want you to take this dose the night before your surgery. You'll take 2 of the pills. It's 600 milligrams. And then after surgery, you're going to take 1 of the pills 3 times a day for a week. So the Neurontin, 1 pill the night before surgery, and then after surgery, you will take that 1 pill 3 times a day for 1 week. That will really help with your pain management on a completely different level than the Tylenol. Number 3, I want you to take ibuprofen. Now, you do not start the ibuprofen until after surgery. And then after surgery, the night after surgery, you can start taking the ibuprofen. And that dosage is 600 milligrams 3 times a day. That you can just use generic ibuprofen over the counter, and you'll take 3 pills 3 times a day. For some of you, you will get a long-acting numbing shot. That's for any of my abdominoplasties, tummy tucks, or big body contouring surgeries. You'll get a dose of Exparel, and that will kick in the night of surgery and kind of really numb your abdominoplasty incisions and your breast incisions. Not all patients will get that because it's very expensive, but for my big mommy makeover cases, you'll get the Exparel, which I'll talk to you about prior to surgery. Icing is an important component of your pain management, but icing is only for my breast patients. So if you've had an augmentation, a reduction, or a lift, icing is really important. You want to start that immediately after surgery. Do that for the next 2 to 3 days. No ice on the nipples. Nipples don't like ice, but tops and sides. Make sure you have a light towel or a t-shirt over your breast, and then use the ice. The best are frozen peas. They're soft, malleable. You can refreeze them. So I suggest getting a couple of bags of frozen peas prior to surgery. No ice on tummy tucks or area of liposuction or a thigh lift or an arm lift. If you have some eyelid surgery, little light, cool compresses on your eyes is fine. And if you have a labiaplasty, some mild icing, again with a light towel over the area, not directly on your skin. Lastly, we will give you pain medicine, narcotics, so don't worry, you will have some of those, but hopefully with the regimen that we've created that I just described, it will limit the amount of narcotics, the oxycodone that you have to use. The oxycodone, you can go by the directions, it's 1 to 2 pills every 2 to 4, but only use that if you absolutely have to and if the other medicines aren't adequate in controlling your pain. Remember, if you take the oxycodone, you have to take the Miralax. It will make you very constipated. In general, the oxycodone makes you kind of high, doesn't do a great job in relieving your pain, makes you constipated and nauseated. So we want to limit the amount of oxycodone that you take. It's not a great medicine. Lastly, at the end of your treatment, the leftover pills of oxycodone, please dispose of those. That's where we're having a big opioid crisis, because those pills are getting in the hands of your children or other family members, and they're very dangerous. So as soon as you're done with your treatment, I want you to throw away those pills and get them out of your home. So hopefully with that regimen, that will help give you the best experience. Again, we'll have this all written down for you, and please ask me if you have any questions. Thanks so much.